look at you, man. Where are you?
I'm actually here in Williamsburg. This is the Jefferson Cup, which is really based out of Richmond. But it's such a big tournament, and it encompasses like several weeks of soccer, youth soccer. Definitely one of the biggest in the country. They're actually at Warhill Complex here in Williamsburg today, so it's a nice day to sit outside and enjoy some soccer.
Absolutely. One of the bigger youth soccer tournaments in the country, the Jefferson Cup there in Virginia. Teams playing, I'm sure on the hour, every hour. And today's topic, you wrote a blog entry on this about static stretching, which has been a staple of the fitness industry, right? I mean, just people sit down or whatever and hold a stretch for a while and think they're accomplishing something. But you're actually giving us a little bit of different advice for people who are about to play a sport.
Yeah, and the advice I'm giving is really based on the research and the blog that's linked to this, and obviously this video will be locked into that blog. Really discusses how static stretching will lead more to injury than to prevention of injury. And in fact, there aren't even a lot of studies on stretching before any form of stretching before an activity reducing the likelihood of injury. But even being out here and watching some of these teams warm up, it's fascinating to see how many things are still done completely wrong.
It's so counterintuitive, though. It just goes against every conventional thing in a way that most of us have been told as we were growing up, about stretching before you compete.
Yeah, I mean, the notion has always been, almost like a wife said, you got to stretch or else you're going to get hurt. Keep stretching, keep stretching. And there are different ways to stretch, and some are better than others. We know that more dynamic movement is better, sports-related movement exercises versus static. But static is still done a lot. Just before we get going, if you want a static stretch after your sport, that's okay because you're not going to go out and then hurt it.
And real quick, you're not throwing static out the window. You're just saying there's an appropriate time and place for it. And right before a competition is not the time and place.
Yeah, and like I said, even here, I was watching as I'm going by before the game start as they, start warming up. They're sitting on the ground and stretching. It's definitely not good. And the reason is as follows: in the bellies of the muscle, we have something called muscle spindles, and muscle spindles are right there to kind of resist stretch. Our body wants to be able to move and have function, but we don't want to have excessive function or excessive movement or flexibility in tissue. And so, before I go a little further with that, there's a difference between flexibility, which is soft tissue based, and range of motion, which is joint based. And so that's why it's very important for athletes to have proper joint function. That's something that your physical therapist has to assess, or your chiropractor, or something along that line. So when joints move properly, then the soft tissues are going to be more apt to move properly. And if they have an issue there, then they're easier to open up. When we have a static stretch, those muscle spindles are being pulled apart, and they're going to get pulled to a certain point where the body says, we're going to have a problem. Either we let these things tear or we have to release them. So the idea behind a static stretch is to get them to release. But to do that, we have to activate what are called stretch receptors. And those are called Golgi tendon organs. And they sit more distal in the tendons closer to the bone. That's kind of like the body's self-defense mechanism against tearing. So they release. And when the Golgi tendon organs fire and release the muscle spindles, you have now neurologically shut off the muscle. When you shut off the muscle neurologically, it could take hours. I mean, there's some studies I remember reading like a long time ago. It could be up to like 12, 20 hours, some large number like that before they really turn on again. So if I go and I do static stretching and then I'm going to go run and sprint and cut, and those muscles are neurologically impaired or inhibited because they're not really going to be moving, that increases the risk for injury, not only around the joint complex, but with the muscle or synergistic helpful muscles in the area as well. So it's actually very dangerous to the athlete.
So you've told us what we shouldn't do before a competition. And I guess we're talking about kids mainly here. What should they do before a competition? Or what should anybody do before a competition? If I shouldn't static stretch, what can I do to help myself move better when I'm preparing for a game?
Warming up is so important. Get the blood in your body flowing. I'm talking about warming the body up, dynamic movements. So I could go out and start passing a soccer ball back and forth. We could do dribbling. So we're slowly moving and then we increase our speed as we're going. In any sport, we want to mimic what we're doing in the sport, because that's what we're going to be doing. So we have to warm the body up. Professional football players I used to work with, let's say they had ankle injuries and they were wide receivers. We'll just an example of that. When I was on with rehab on them, I would take them out back and I'd say, let's walk the route. Now 25%, now 50%, now 75%. Then you have them run and cut hard. You got to start warming that tissue up so it can accommodate the movement that you're trying to do, especially coming off of an injury. You want to check to see how good your rehab is with stuff. But you want to see how much their joints and their soft tissues can handle. So in a general setting, even without injury that kids are recovering from, They want to warm up. We want to get them to basically replicate their activities, whether it's lacrosse or soccer, or it's a football or basketball. They have to be going out there and doing a slower, more modest, laid back form of what they're doing, and then building it up and building it up and building it up. The whole idea of going out there and saying, oh, we need to like stretch our hamstrings a lot, or we need to go out there and stretch our quads a lot. I mean, you're using them both, when you're running, and you're running forward, the hamstrings are stretching under load eccentrically, while the quadriceps are then shortening, concentrically as they're moving. So everything is getting moved. So we don't want to really isolate a particular muscle group and say, ooh, let's stretch it out. What we want to do is just get everything moving. And that's the safest way of doing it.
When I used to coach little kids, when my kids were small, I would have a running debate with myself uh, whether little kids even really needed to truly warm up. It seems like little kids are just built ready to go. It seems different once you get to about puberty and the body starts to transition to becoming an adult. Something just seems different. Injuries seem to happen more often.
The recuperative ability of the body is far greater when you're younger than as we age. So little kids can get away with a little more, and as you get older, by the time you get to like 25 to 30, things
Mhm.
start slowing down a little bit. So we have to really warm up, get the blood flowing, and really get things moving a little bit better. It doesn't mean you have to static stretch, but we need to be a little bit more dynamic and get things going. But you're right, little kids seem like, oh, they can just go out and just run around and they'll be fine before they get going. And although there's truth to that, what we want to do with kids is instill in them the value of proper warming up, because they're not always going to be 6, 7, or 8 years old. When they get older, it's going to be a little more important to get the body going to avoid injury. We want to develop good patterns early, so that they're then applying that knowledge as they get older.
Absolutely. And if we educate the coaches, then the coaches can in turn educate the kids just a little bit. So
Yeah, and there's a lot of misinformation still out there, and unfortunately, it gets passed. It's like generational, like it just keeps going and going and going, and even we've got to break that model, and there's plenty of science to substantiate what people, in my field and physical therapists, athletic trainers are saying.
I've learned as I've gotten older, more likely way older. I wish I would have known this when I was younger. I dreaded stretching any sort type of mobility work because I'm not good at it. And it's really more miserable for me than going out and running, a 5K or something like that. But what I've learned is mobility training is strength training. And there's definitely a place for it, during the week. Say when you're just training to become a better athlete, better at your sport, you can improve your performance some by improving your mobility.
I mean, that's a 100% valid point. In fact, in functional movement, um, they discuss how mobility trumps stability, because they'll have a debate usually like, what's more important, being stable or being mobile? If you're not mobile, you can't create stability. Nothing's going to be working right. So we have to move properly. And then once we move properly, and then at that point, we can get into the more stability based patterns and training, because we have to have proper function. If we are moving well and then we try to stabilize or strengthen, then we're building over an area that isn't moving well, which just leads to injury as well. So it's a
Hmm.
combination of both, but mobility does trump the stability. We do need to move well, but that movement is more generalized. It encompasses the flexibility component, as I discussed, with soft tissue, but also the range of motion component of the joints. And no one really on a field in any sport is assessing joint function. And then if we really want to get into articular neurology, which is getting really deep here for this conversation, we want to look at it. There's something called arthrogenic inhibition. And that's well documented in the research, usually after surgery, the hip or the knee. And what it basically discusses is when the joint isn't working well, the adjacent soft tissue starts to atrophy and it doesn't work well also. So we think of all these athletes that don't really have a lot of injuries, but they're not really moving as well as they should be moving. But then their tissues can't work well. So they might want to get around that by stretching and stretching, saying, I just can't get this tissue to release. They keep stretching it, it just will tear. Meanwhile, the joint's stuck. It isn't moving well because the joint neurologically, the brain through the joint is telling the body to shut the tissue off because the joint isn't working well. So to look that up and read about it, arthrogenic inhibition is a phenomenal phenomenon that occurs. We see it all over sports, but most people aren't identifying it. And a lot of injuries are to do that concept as well.
And I won't keep you much longer, but one thing that I have yet to figure out, all right, when I do my mobility training and I make a little bit of progress is how do I retain it? It just seems like, yeah, I got it, for a day or so, but then, the next day, the next 2 days, it sort of goes away. Like I've lost it and I'm starting back over.
I think a lot of times people address, it's a very much of like an allopathic approach. Like, I have a problem here, it hurts here, I treat here. I have a tight muscle here, I just work on that muscle. But we kind of have to look at a slightly more holistic global position with that to say, if I'm always tight here, maybe something else is causing that. Where else do I need to go? If let's say we're talking about the hamstring, is my ankle dorsiflexion good? Is my knee moving properly? Are my hip joints able to internally and externally rotate? And am I able to get the hip joints to move well? And I think a lot of times when it's like, oh, it lasts a couple of days and then comes back, we're maybe not addressing or finding what's really a contributing factor to the problem, and we're only treating the area. We're not looking at what's causing the problem, and always we want to find what's causing the problem.
That'll be a great topic to dive into on a future episode.
Sure, absolutely.
Today's big takeaway point is to not do static stretching before you're about to compete. Look more towards a dynamic type warm up, and that'll have you
Yes.
better prepared to go out and play.
Full body warm up, increase in heart rate, get blood flowing, and yes, more specific to the sport with what we're going to be doing at a slow rate and then build up.
All right, Alan, where can everybody find you on social media?
Find us definitely, on YouTube at Don't Be Meathead, Facebook, Twitter. Look for us. We're out there. We're having a lot of fun. We're educating. And what I tell, everybody I meet and I tell my patients is help us help you. Get the word out, and we're here to help.
All right. You can also find Dr. Manison there on the sidelines of youth soccer matches. So I hope it goes well, man.
So do I.